Bulbinaka Fiji. I trust that we all had a restful weekend and that we were able to appreciate our mothers, whether it be in person or from a distance. Today, after 1,380 tests, we have one new case to announce. The new case is a woman from Kalokalo, Makoi, who presented to Makoi Health Center today with COVID symptoms. She was tested today and turned positive. At this very early stage in the investigation, we know a link has been established between this case and others. We are treating this as another case of community transmission until proven otherwise. The contact tracing, testing, and isolation protocols are currently activated regarding this case, and Makoi Center is currently closed for now. Due to the steadily rising number of cases across Viti Levu, the borders of all the 6 containment areas, Lotoka, Nandi, Rakiraki, Lami, Suva, and Nosori, are being maintained. The confirmation of cases of unknown origin in particular indicates the virus could still be present in all 6 areas. So the borders must be enforced, as must other restrictions that we have in place. When the data tells us to proceed in a different direction, we will tell you. My teams and I sit down every day to go over how we are managing this nation's COVID containment strategy. I encourage every household and community to spend at least 1 day per week reviewing how your group or bubble is managing the risk of this outbreak. You need to take some time to talk through the schedules and the routines of the people who share your bubbles with you. Talk with your children about how the virus can be spread. Sometimes telling people what to do isn't enough. We have to explain how our measures work and why it's important that we adhere to them. For the benefit of hundreds and thousands of Fijians who hear these announcements, I have explained how the virus travels and what is proven to stop its spread. We publish these announcements in the vernacular languages as well. I am asking those who do tune in for these announcements to help spread the message faster than the virus spreads. You do not need a medical degree to understand why it is important to wear masks or to wash your hands. If you can turn your phone on, you can install a Care Fiji and keep the Bluetooth turned on. It's very simple. And the difference between a crowded shop and the safety of your own home should be obvious to everyone. Movement across Viti Levu is currently restricted for essential purposes only. The purpose of limiting movement is to limit mixing between people. We are dealing with a highly transmissible variant and several unknown chains of transmission. So we want people to operate in bubbles, stay in bubbles as much as possible. If the virus stays with one person and that person does not mix with other people, the virus eventually dies because it has no new host to go to. Our next steps are being informed by the best available science. They are taken based on the data that we gather from contact tracing and testing, with the advice from other ministries and the experts from WHO, along with input from businesses and organizations, all of which we have fully invested in the success of our containment strategy. From an epidemiological standpoint, from an economic standpoint, and from an employment standpoint, we are considering all angles in this wide-reaching crisis. You'll remember that the last lockdown we implemented was limited to Suva and Nosori. And it was done for the purpose of contact tracing. It came into effect suddenly so that those contacts could be located. And it worked. We found everyone we needed to find, and it ended quickly. Now, a more sustained lockdown, however, will require a greater strategic approach. At this point in time, I just want to explain something. In the last lockdown that we had, it was 56 hours. The objective was to locate and contain a specific group of people. It is different from the kind of lockdown that is required to stop the virus. To remove the virus, to go for viral elimination, you have to go for a longer period of time. It's a different type of lockdown. So with a full year of experience behind us, we have a much greater understanding of the virus and a range of tools to use to fight it, including stronger testing capacity and the Fiji app. We can be targeted in our approach, so that if we do lock down an area or even the whole of Viti Levu, we do not place undue hardship on people and businesses. In other words, future lockdowns, should they be needed, will be targeted and active. They will be targeted because the lockdown area will be defined as narrowly as possible, and they will be active because we will endeavor to permit the broadest range of movement and economic activity if possible in bubbles that mitigate widespread transmission of the virus. We want essential services to continue, and we want as many people as possible to go to their jobs and open their business. We cannot expect our economy to recover if we shut down entire industries for weeks on end. Some of these jobs, particularly in manufacturing, may never come back. As such, businesses, organizations, communities, and individuals are all in this campaign together. All of us are only as strong as our weakest link. Adherence to our COVID-safe measures everywhere in Fiji, at every level of society, is the only sustainable way to manage the crisis. Whatever step we take, whether this is legally mandating mask wearing, or the use of the Care Fiji app, or even reintroducing a 24-hour curfew, our success will ultimately come down to the diligence and the vigilance of the public. Many people are making adjustments to keep themselves and their loved ones safe. We see you and we appreciate you. But too many of us are still pretending as if there is no threat in our midst. As if the world is still the way it had been more than 1 year ago, before the coronavirus spread across from country to country like wildfire. This pandemic has changed societies in a long-lasting way. It has changed the way people interact. It's changed the way people do business, and Fiji must change with the world. I want to address some confusion about the purpose of the Fiji Emergency Medical Assistance Team, or FIMET Field Hospital. The FIMET Field Hospital in Lautoka, it takes the strain of Lautoka Hospital, which is now designated for the care of COVID patients. The field hospital treats the cases the hospitals would normally expect to treat: acute cases, accidents, childbirths, and other non-elective surgeries, for example. We are doing this because we don't want to put non-infected patients in the same hospital with the infected patients. There is a risk of transmission, and we can't have medical staff going from one group of patients to another group of patients. While the field hospital is technically only for emergency case, we will see whoever comes through the gate, aside, of course, from patients showing COVID-like symptoms. Maternity care will also be done in the FIMET hospital, while deliveries will be on board the MV Vevueti. Further care of sick mothers and babies will be in the new Bar hospital. While our Lautoka hospital is now fully dedicated as a COVID care facility, with our Lautoka hospital now fully dedicated as a COVID care facility, I want to thank groups like the Denarau Corporation Limited for helping us provision the personnel who are living and working in the hospital, as well as the private doctors who will soon be offering their treatments and consultations to those who would normally go to public hospitals. But these private doctors will be able to deal with non-COVID care. Regardless of whether new restrictions come into effect or others relax, support from businesses and civil societies will be critical. In this campaign, the nation needs to work as a unit. we are stronger together against whatever comes our way. Whether it is through the simple act of staying home or direct support for our healthcare staff, we are grateful for the solidarity that you show with the ministry. Thank you.
Good evening. As announced by the Permanent Secretary just now, we have one new case to report. Also, 3 more patients have recovered, so there are now 36 active cases admitted in isolation facilities. Of these, 7 are border quarantine cases, 23 are cases of local transmission, and now 6 are under investigation to determine the source of transmission. Of these, the recently deceased case, which was our 3rd COVID-19 death, and a recently recovered case are also still under investigation to determine the source of transmission. Cases under investigation are still considered as community transmission until proven otherwise. Fiji has now had 140 cases in total since we first detected a case in Fiji on March the 19th of 2020. We've now had 101 recoveries and 3 deaths. A total of 66,605 COVID-19 lab tests have been conducted since we started testing early last year, with a daily average of 1,660 tests per day over the last 7 days and 1,380 tests conducted just yesterday. Yesterday's test count from 2 labs has not yet been received, so it's most likely that the number of tests yesterday is higher than actually reported. Our weekly average of testing now is at 8,529 tests per week, average over the last 2 weeks, and last week we tested a record of 10,237 samples. Our overall test positivity, so the number of positive samples we have out of the total samples we test, is 0.2%, and our 7 daily average daily test positivity is also 0.2%. An average of 1.9 tests per 1,000 population was conducted daily over the last 7 days, and 9.6 per 1,000 population average over the last week. To give you an idea of what this means, the WHO recommendation for testing is at about 2 per 1,000 population per week. We're now at 9.6 per 1,000 population per week. Thank you.
Good evening. Our screening activity throughout Fiji continued. Slowed down yesterday for obvious reasons, but a stationary clinic remained open. In the last 24 hours, we screened 786 individuals and swabbed 141 individuals, bringing the total to 52,071 screened and 8,256 swab. The mobile community screening also slowed down yesterday, and we a total of 1,796 individuals were screened yesterday. Our community isolation facility remained open. And yesterday we had 53, in the last 24 hours we had 53 individuals located in 3 community isolation facilities in the last 24 hours. As stated earlier by PS, while the Kamikamida Health Center remains closed, the FEMAT Field Hospital is now fully operational. With patients admitted and surgical operations undertaken in the last 24 hours at the hospital. So for the people of Lautoka, while the Lautoka Hospital is the designated COVID hospital, so looking after the 130 plus patients in addition to the staff who are all in lockdown in the hospital. The Punjas Health Center, the VCSA Health Center, and the FEMAT hospital are the government-run facilities that are available and operational to provide medical care for you. And obviously for those who access GPs, the general practitioners, the private providers in town, those are also available. For the rest of the ministry, the health staffs and frontline teams throughout Fiji are on high alert and involved in case finding and containment efforts. Regular virtual meetings, trainings and retrainings are ongoing in all divisions to update and prepare our staff. Today in the Northern Division, they're taking advantage of their zero case status, and they've started a 2-day training course in Lambasa under COVID-safe measures for all civil servants, including health staffs and the discipline forces in infection prevention and control, organized by the heads of health services in the division and the Commissioner Northern Division. The health team, the frontline team and civil servants who are part of the responses are willing and ready to play their part in the current campaign to contain the COVID outbreak in our community. We are asking again that the rest of Fiji play their part by staying at home, wearing masks, washing your hands regularly, practice the correct way to cough and sneeze, download and activate the Care Fiji app on your phones, and guard your bubble. Make this your commitment and contribution to this campaign. Nawalev.
Thank you very much, sir. Members of the media, we're now open to questions. You state your name and organization. Also remove your mask while asking the question. Thank you.
Hi, Shanil from Fiji Village. Dr. Fong, there are now 6 cases where the source of transmission is unknown. What is being done to establish the source? Because you had previously said that this is worrying for you.
Good. There's 2 parts to this equation. One is to establish the source, and one is to respond to the contact tracing. As anybody would understand, we would be rather limited, or you can't keep looking for the source. If once you cannot establish the source, then your only problem, the only course forward is to respond to what you see, which is currently what we are doing. Samples will be sent for genomic sequencing, and we will try to see whether the genomic sequencing makes them similar, and that will help us to some extent. But I guess at some point we can only endeavor to go as far as we can, and if we can't get that, then we keep on responding to the new cases. The reason why we want a source point is only because from the case to the source point, if we track it from there, we can actually find more contacts. But in this particular field, apparently if you can't find the source point, then you just react to what you see.
Dr. Fong, also there are reports that some people moved from containment zones to non-containment zones over the weekend. How many of these people have actually called or contacted the ministry, and what is being done to locate these people?
There's been a number of different strategies that have been done. I've received a number of calls from concerned members of the community. They give me the location. I've sent it to the relevant response team in the subdivisions, and they have gone out to go and respond or to screen them. What we've not done is that we have not told the community to go back and chase them back to their... We said, no, don't do that. Now we want the community to support us in watching the home isolation protocols that they are doing. I know a few villages, they have decided taking it upon themselves. They've identified the houses, they've told the houses members to stay in, and the villagers are now cooking for them and supplying them with food. So this is what I mean by a community-wide response that doesn't play the blame game. You know, a community-wide response that actually supports everybody to become safe. And this is what many of the people in the community are doing, and I'm very happy for it. Initially, people were reporting them in because they were playing a little bit of blame game, but eventually, after a bit of talking, many of them have said, yes, 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 I see where you're coming from. Let's, we've got a problem. Rather than try to blame them for coming in, let's just go and make it safe. And that has to be the way that we move from now on. Both from the very beginning of this campaign up until now, we've always said that. Let's not work on the blame game. Let's just work on mitigating whatever risk that we incur.
Molavina Galina Rees from FBC News. Dr. Fong, very quickly, just on that previous question, the breach, the border breach and the confusion over the weekend when movement between containment areas was permitted. I wanted to ask who will be held accountable or taken to task for this. I understand measures have been put in place to establish the whereabouts of these people, and just under the Public Health Act, aren't people taken to task if they break the law? And would you be able to shed some light as to the confusion around the lifting of the lockdown in the Wainitarau settlement that didn't take place until 6 hours after the initial time of 4 a.m.?
The confusion around how people were able to move when they were not supposed to move, I must admit, I was and am still about as confused as you are, because I did mention it quite clearly in the press conference. They move only from containment to containment, non-containment to containment, not from containment to non-containment. And I said the movement was only in Viti Levu. So usually that gets activated as such. As far as moving towards taking some people into to answer for the actions on the ground, at this point in time, like with this fight I've been mentioning, the last thing we want to do now is to go and castigate every misstep or to come down hard on every misstep. We just have to respond to the situation. And so that will be, that's the way I see it. We will just have to respond to it. There's probably not much point in trying to find blame or to lay blame on anybody else. The issue about Wainitarau, I'm about as confused as you are. I got some news this morning that they were not opening at 4 a.m. like we mentioned. Maybe there's a little bit delay in the communication going down to the ground, but those are issues that we will improve as we go along. You must admit, you must understand, the team is quite vast, and everybody is trying to play their part, and many people, they play sometimes we play the part of being safe first. So if they haven't heard the news come from their own boss, then they will not make a move, and that's acceptable. That's part and parcel of how, when you're mounting a big response like this, the various pieces of the jigsaw puzzle all may not operate as cleanly as you would want it to be.
And just the lockdowns that you mentioned, you had highlighted that no policy has been taken off the table, and you've been talking a lot about lockdowns. Is this likely to be happening soon?
Yes, one of the things that we need to do is to prepare Fiji for the long haul. I cannot, given the way that the cases are coming up, I cannot take away the possibility that we may have to continue this type of operation for a very long time. I cannot take away the possibility that we may have to enforce another 24-hour curfew type of lockdown. And it behoves all of us. If people are thinking while they're watching this, they would probably start stocking up on their non-perishables. They'll probably start looking at some kind of goods that they might have to keep in store in case we have to have a rapid lockdown. So we need to be prepared for all eventualities, and this is the reason why I say the way I talk. I don't want to be committed to one direction, but I want you to be open in your preparation for all types of course of action.
So, Litya Rava from Fiji Times. Maybe you could just give an update on the local cases, and that is on whether it's from the same B1617 variant, and also on the 6 you mentioned. the source is yet to be identified. Does the ministry have a working hypothesis on where they might have got it from?
As I mentioned, we sent off those specimens to Melbourne. The specimens don't like. It's not like you send it off and they get back quickly soon after. It's not a very quick process because the whole process of genomic sequencing is never fast. So I guess as I mentioned, we're reaching at the point now where the sequence is not as important as the way we are going to respond. And we are responding as if they are community transmissions, because that's the safest way to respond. If we do get the sequence, and if the sequencing or if the evolution of the infection is tracked adequately from its source, and we find other areas that we can work with that can allow us to narrow down our response, we will do that. But science, unfortunately, there is a limit to science. There is a limit to science. Science will not tell us every single detail about how the virus moves. So what we can do, the best we can do, is we try and get as much history as we got. We look at the genomic sequencing and some of the testing data. And once we reach a certain point, we'll say, okay, that's it. Let's just concentrate on this information as being enough, and let's respond. And that's basically what's happening at the moment.
But Dr. Fong, for the current cases that we have, is it all from the same?
Again, I haven't got that information yet. I haven't got all that information. The genomic sequencing does not happen fast. It takes a while. And as the more the cases we have, the longer it will take for us going to get a return in our results.
So just my next question, this is regarding mothers who are at the Lautoka hospital right now, in terms of the safety measures that the ministry has in place for them.
I think I need to be clear about one thing. I think the perception that Lautoka Hospital is a cesspool of active infection is the wrong perception. Said? In a way, Lautoka Hospital right now is probably the safest place to be. The reason being, they run tests. They test 400 people. They turn over the test every 4 or 5 days. They test everybody in the Lautoka Hospital. Then they come back again. They test again. And they test. And they actively separate all the positives from the negatives. So whether they're symptomatic or not, you still get tested. So it's very unlikely that when you're positive, you'll be infectious. And then you get separated so early that, you get a pure pool of positive people and a pure pool of negative people. So at the current time, we can't do that type of measure in the community. I can't go through all of Lautoka testing. Everybody go this side and then test this, but more than 300,000 people, if I'm right. That will never be able to happen. So in terms of the safety of those living in Lautoka from COVID-19, in my own opinion, if you look at it from that angle, they're probably much safer than everybody else around Lautoka. Because we know where the virus is in that Lautoka hospital group. They have been adequately separated, made sure that they are non-infectious. The PPE protocols are much harder in that known group of positives versus negatives than in the community. So, that's the way they function in Lautoka, and I think that people should not they should not perceive Lautoka Hospital as being a dangerous place to be. We have enough protocols in place to make sure that it is safe. And there is currently, as I said, the biggest thing that makes Lautoka Hospital safe at the moment is the fact that they're running tests back and forth on all 400.
Hi, Dr. Fong, Live for Radio New Zealand today. My question is to do with vaccination and crowd control. Given that you've received a new batch of the AstraZeneca vaccine, can you tell us about your plans to roll them out? Who can get them? Only Fijian nationals or not? Do you have any considerations for people with underlying infectious diseases? Fiberjo about this earlier in the week, but also a concern that's come out from the public that the current vaccinations, or the ones that was rolling out last week or the week before that, was attracting a lot of crowds, and that it looked like there weren't very much by way of crowd control or social distancing happening at these places. And considering that you're discouraging social distancing, that's not happening at these places. What are your plans for the next batch of vaccines?
Yeah, I agree that there were some instances where the lines were not looking good. I think it's not only in vaccination. I mean, I know today in Lotoka they were giving out $90. You had to go to a certain place to get $90, and that line also was not. It took a while to get managed. I mean, at the end of the day, human behavior is human behavior. You know, you can't expect everybody to follow rules exactly the way you say they should. Eh? So the team, the vaccination team, have come up with another plan. They're sorting out a way that allows us to manage lines, manage queues, establish a lot more COVID safe protocols. You can understand how it is a little bit difficult because we're trying to get as many people vaccinated as possible. The good thing about the current batch is that the expiry dates are a little bit more friendly. It allows us to spread ourselves a little bit more in terms of deploying these vaccines. So we're not in a huge rush. So we can actually start targeting people a little bit more specifically. Prior to this, the expiry dates were just a little bit too close, so we had to move it fast. So that was part of the reason why you saw the lines that you saw. But I think we have a better opportunity now to manage because the expiry dates are a bit longer.
Are they open to everyone? Can everyone in the country above the age of 18
Everyone in the
get it?
country above the age of 18, absolutely. We just need to get them registered, and if you cannot be registered online, there is the option of face-to-face registration, where somebody holds a tablet and puts you into a certain category of group of people that are pending registration. We inject you first, and then we'll get you into the proper list for registration.
Bula Merioni from Fiji One. My question is for Dr. Chimesa. So how many patients are being catered for by the FEMAT Field Hospital? And considering their cases being detected at the health centers, what actions or steps are being taken to avoid any outbreak or cases at the field hospital?
Thank you. So the team have, the hospital has a triage place where anyone who comes in gets triaged and assessed, and their COVID status is determined, whether they are possible COVID or otherwise. And from there, they are directed whether they go into the FEMAT hospital or they go to other services that are provided. The FEMAT hospital operated fully, today. In the last 24 hours, when I called this morning, they had completed an operation on an individual, and there was also one inpatient at the hospital. But throughout today, they've continued to see patients, admit patients, and as well as undertake operations.
Dr. Chimesa, can you also talk about the individuals going out to do screenings? Are they going back home, and how do you ensure that they are safe?
So, are these from the FEMAT hospital?
An overall screening process.
Okay, so there are standard operating procedures and processes in place. We choose the individuals that go out, and we train them, particularly around infection control and the use of PPE, and then they are sent out in teams. So when they go out and do screening, they are fully clad in protective PPE, and they follow the SOP for doing the screening. So it's not only the clinical bit where they actually talk to the person and take the temperature, but another big part is recording and making sure that we have our records up to date. So far we have not received any reports, any issues with the screening team. We are fairly happy with their work, and we are confident that the work that they are doing according to the SOPs we set in place.
Sorry, Dr. Fong. So my question is around case 135. He's the maid's son-in-law. Yes. Maid's son-in-law, he tested, well, his status was announced last Friday. I understand he had been in quarantine since 18th April. So because he does not conform to the 14-day incubation period that we know of the virus. Is that?
Oh, I see what you mean.
Is that
But, sorry, the perception that you have is that for as long as, because he was there, he got he went in, I think it was day 20 or something like that, then it turned positive. See, what happens is that when we go into quarantine, the day of your quarantine is reset every time you have a positive person that is removed from your quarantine facility, from your quarantine room. It's going as a family. So in that family, every time somebody was positive and had to be moved away, it became day one again for that family. So I think in that family there was about 2 or 3 positives in that family, and every time we had to move them away, it turned back again to day one. So in actual fact, this person got positive within the 14 days, but it's within 14 days of the last case that left the room. But I can understand what you mean. From the public's perception, they can say, hey, that looked like took a long time for him to get positive. No, I say we're not counting quarantine days. By definition, a quarantine day is always counted from the last day of your exposure. So it's slightly different when you have a big group of people sitting in one room as a quarantine. That's why it's nicer when you just have only one person per room. It's easier to read the quarantine days as 14 days. But when you have 2, 3 people, every time you get a positive, that becomes a reset.
So we'll just give one more question to you.
Dr. Fong, you have to make a tough call here. How do you balance economic hardship and increasing community cases, as it may delay recovery and everyone may suffer for a longer period of time? Can you please elaborate on that?
Yes, there is a consultative process that I'm going through. Okay, there is a very strong consultative process that we are going through to mediate that difficult path that you're talking about. One thing I do know, if we call for a lockdown, a severe lockdown that goes for, say, 14 days or 21 days, the public will expect that that severe lockdown must work. There's no chance that it cannot work. Because of the suffering that they will endure, they say, okay, it must work. Now, in order for me to make it 100% work, everybody in their house have to keep still. Walk around your yard only. Okay, the problem is, if people start to get desperate, they want water, they want food, the electricity finish, the water, rain come down and the roof, big leak, then there are leakages. And that means that 21 days will be spent for nothing. It is because of that particular problem that any effort to consider or to talk about a lockdown has to be a fully coordinated effort with a whole of government response. Right down to the detail where we should have one person to be on standby, maybe if somebody's roof leaks, this person run quickly and go and fix it. It has to be that type of detail. Not just say lockdown and finish. The 56-hour one, like the one we did during the weekend, that one was, we could call it, because we knew it was short duration. But a long duration one will require that we have teams actively moving around to ensure that the needs of the people are still met, despite the fact that they are under lockdown. And therefore, it has to be a planned process. It cannot be just something that we throw in just immediately. Okay? It's been done before in other countries. They have a nice planned process. They have food delivery services. They have various other services that are in place before they can make it happen. So that's the kind of processing or planning that we are currently indulging in to see how we can evolve so that we have options. We are not saying that we are going into that severe lockdown, but we are starting to plan some kind of support measures so that we have options of the type of lockdown that we can ask for.